Hi dear students, welcome to the class of Kidscovery. Myself Dr. Parv. We are discussing a unique topic, important topic that is called as breath holding spells. Now what is breath holding spell? See, it's nothing but then a tantrum which is thrown by the newborn kid who wants to gain attention. So can you see the breath holding spell? Can you see this child who is turning like bluish white because he is just holding his breath during crying? So breath holding, of course, that's going to have apnea. So that's an apneic event which is going to be seen in the children. So breath, so 1, 2, 3, 4, 5, 6. So apneic is actually 6 words. So please remember 6 months to 6 years of the children, they are going to have this, and it possibly leads to loss of consciousness. Okay, so there will be a loss of consciousness. Why? Because if there is apnea which is going to be there is decrease cerebral blood flow, and that is why there can be loss of consciousness which can be happening because of the breath holding spells. So of course the types, one is going to be cyanotic, the other is going to be pallid. Okay, so either there will be cyanosis, bluish, or there will be pale colored, which is going to be there because of the breath holding spell. So the child will be angry, child will be frustrated, child can have injury, and reprimand. Okay, so these are the triggers for if the child is angry, frustrated, has got an injury. So these are the triggers for the breath holding spells. And the features are going to be, the child is going to, so whenever you cry, you just you do a forceful expiration, like, okay, so forceful expiration is going to be there. There can be apnea which will be there will be cyanosis, and can be followed by loss of consciousness. So what is pallid? Pallid is actually pale child. That is because of the minor fall or minor blow that can cause a pale child. And there can be loss of consciousness in this also. It can be followed by apnea, ceasing of breathing. Associated features, it has been seen that they are generally having iron deficiency anemia. So you just have to order a CBC to check if the child is having IDA or not, that is iron deficiency anemia or not. The prognosis is excellent. Please counsel the parents that there's nothing to worry. After 4 years of life, these things are going to get normal, sorted out, and the brain of the child is absolutely okay, just like your brain is. So sometimes you feel, no, I'm not capable of learning enough, and maybe to retention hi kharab hai, my retention is not good. There's nothing like that, my children. Everything is good. You just wait and watch. The destiny has planned everything so beautifully for you all that everything is going to be super perfect, super fine. Just tell yourself everything is good, and the good will happen to you. Thank you so much for joining. We'll watch you in the next class.